Hi, everyone. It's Leanne West, and I'm president of the International Children's Advisory Network. I just want to welcome you today to Ask the Experts with Anthony Chang.
So we're going to go ahead and get started now. Again, thank you so much. Oh, yes. So if you could remove your last name from the Zoom display. Sorry, I got a private message. That would be perfect. So we're going to go ahead and get started. I'm so excited to have y'all here for Ask the Experts. As a reminder, Ask the Experts, we have a monthly session where we invite an expert within their field, and we're going to have them share their incredible journey with us. And in the first session, we ask questions like a fireside chat to our guest speaker. And then towards the latter half of the session, you'll have the opportunity to write questions in the chat, and you will be able to get an intimate session with the actual featured speaker. And our featured speaker today is Mitch Herndon, and we're so excited to have him on. And he will be speaking about empowering patient journeys, exploring patient engagement in clinical research. And just a little brief info about Mitch is that he is head of clinical study patient engagement at UCB, and he has had a 28-year career in patient engagement and clinical research, which is amazing. And we are so honored to have him on with us today, especially as iCAN specializes in providing opportunities for patients to be engaged directly with medicine, innovation, and research. So we're very excited to have him on today. So if you want to all write in the chat, welcome Mitch. We're very excited to have him with us today. But I'm going to go ahead and get started with the fireside chat, and we're going to learn a little bit about Mitch's journey. So Mitch, if you could share a bit about yourself and how you ended up in patient engagement in clinical studies.
Sure. Yeah. Thanks, Sabina, and thanks for the opportunity. I use the term expert loosely. I would say everyone on this call is an expert in what they do, and we'll talk more kind of how my feelings on that. But I'll talk a little bit about my personal life and my professional life, because I'm a firm believer that we all are holistic. We don't just do our work job and leave our personal life at home, and vice versa. Our professional world often interacts with our personal life. So I'll start kind of early on and work from local to national to global. So I come to you from Chapel Hill, North Carolina. If you're familiar with the state of North Carolina, the University of North Carolina is like 2 miles down the road, a great small college town. Born in Charlotte, so I'm basically a North Carolina guy. Been in North Carolina my whole life. It's important to start where I was raised. I was raised by my mother and father. They were both public school teachers, and I have one brother. So growing up, I was a little brother. And if you can in the chat, you don't have to now, but at some point, please chime in whether you're a brother or sister, if you have brothers or sisters, or if you have close cousins. I'm a huge believer that as you grow up, it's that environment that you're exposed to that helps create who you are. So fast forward, now I've been married. We're going on 25 years. I have the pleasure of marrying my wife 25 years ago in September. We have 3 wonderful kids. We have a 20-year-old, 17-year-old, and 14-year-old. My oldest is at Penn State University. I don't know if Leanne's on, but he applied to Georgia Tech, didn't get into Georgia Tech, but he did get into Penn State, and he's now a rising junior. He's enjoying it there. My daughter's going to be going to Maryland. She's a senior now in high school, will be going to Maryland. And then my son, my youngest, is a high school. Throughout my professional life, I've done things on the side like volunteering at the local, national level. I've done a lot of basketball coaching over the years. Had a lot of fun with different things throughout my life. So that's all the personal stuff. And I'll get to why I mentioned that, because it's important. But the professional stuff is kind of what Sabina said, 28 years. Wow, it's really scary to think about 28 years. It does go by really fast. I guarantee each one of you, at some point you'll look back and think, wow, 10 years ago I did this, 20 years ago I did that, and it adds up pretty quickly. So that professional world, it started as an internship. So my first recommendation to each of you is do an internship as quickly as you can. In high school, there are possibilities. Certainly in college, there are possibilities. But it was really my internship as a senior in college I was at the East Carolina School of Medicine. They've changed their name now, but it's a hospital where they do outpatient and inpatient clinics. And I was at a pediatric clinic. So I was basically a medical social work intern, and I had two wonderful mentors, and it's okay to say their name, but Brenda Arnold and Rhonda Stanley. And I've kept the connection a bit over the years, but I was so lucky to have them be my mentor that shaped my view at the time. And I had a different lens that they helped give me at the time. So that exposure in that 6 months really kind of changed my trajectory. So my first job was at a national nonprofit patient organization. And so notice we've gone from kind of local to national. So this national nonprofit, they've changed their name over the years, but this was the early 90s, but it was called the American Social Health Association. We had offices in DC and in Research Triangle Park, North Carolina. If you're not familiar with RTP or Research Triangle Park, it's a really cool spot. It's not one town or one city, but you're surrounded by a lot of academia, a lot of businesses, a lot of biotechs, a lot of pharma. It's a great place to be, and I've basically been in that area for 28 years. But for those, I spent 10 years at that patient organization, and that's really where my patient engagement world began. This was before the internet. It was right around the time the internet was starting. Websites were starting up, but we had support groups, call centers, resource centers. We started chat rooms at the time, which a few of you could probably search that up to see what they were. But that patient engagement really started then. And that's where I started doing more in the research world. It was both behavioral research, but also clinical research. We worked a lot with different pharma companies. We worked with state and federal government. So it was really, really good. Then I went to, after 10 years there, I went to a contract research organization, or CRO. Many of you are probably familiar with CROs. They're companies that work with pharma companies, and they run clinical trials across the world. So I spent 10 years there, and that's where I did everything: patient engagement, patient recruitment, patient retention, patient experience, worked globally, did a ton of traveling from all across the US to every continent, from Australia to many European cities, South America. Did a ton of traveling, was able to speak with and interact with so many different patient populations and different professionals, but really, really understood the importance of the patient voice. And those 10 years of working with pharma, but then patient organizations, and again, different patient populations, different therapeutic areas. It was chronic conditions, it was acute conditions. It could be something as simple as working on a study where you had a wrist or ankle sprain and you wore a patch for a week, to life-ending situations where you're dealing with children that the lifespan was not more than a year or two. So clinical research really, really is important. I can't emphasize that enough. But it's during that time that I really learned so much and kind of grew my experience and exposure. It was I still obviously work a lot with CROs, but I'm now on the different side of it. So anyway, did that for 10 years and then joined UCB. And I'm now at UCB going on my 8th year. So if you do the addition, that's that 28 years that Sabina mentioned. So for the past 8 years, I've been at UCB, and this is where I had the pleasure of working with iCAN. So I met Leanne probably 6 years ago. It was definitely 2 or 3 years before COVID. And I don't know if Leanne's on, but she came to UCB. I don't think we met in Europe, but I think it was in Raleigh. But that's when my interactions with iCAN began. But throughout these 8 years, we have a team that we support clinical study teams across the globe, whether it's Japan, whether it's Asia Pacific, whether it's the full European set of countries, whether it's North or South America. Our team supports the patient engagement efforts across the portfolio. And it's probably about five therapeutic areas that we support. So, I mentioned patient engagement, patient experience, and patient retention and recruitment, but many of you are probably familiar, in the engagement side is about the patient voice and really incorporating the patient voice. And it's important to do that. So I'm proud to say at UCB, we take pride in that. And that's why we have the relationship that we do with iCAN. Diversity is huge. I would add to that the patient voice from youth is huge. Pediatric studies are hugely important. They don't get enough attention. And so this is where everyone on this call, no matter your age, you have the ability to impact us. You have the ability to impact the clinical research industry. If the fact that you're on this call, the fact that you're interacting with iCAN, that's a huge emphasis of importance and a huge, I think, something that you want to keep throughout your life. You can build that experience that you're working with iCAN. So also, two other things I've been during my time at UCB, I have been on the Transcelerate. It's a private-public partnership with different pharma companies and industry. Also been part of IMI, Innovative Medicine Initiatives. That's a global partnership that includes work with patient groups and academia. So really have had the good opportunity not just to do my work at UCB, but working across industry. And so sorry, Sabina, that was a long-winded answer to your question.
No, we love that, Mitch. We love learning tidbits about your life and also learning about your professional experience as well. And I'm actually also currently I'm a full-time teacher, just like your parents, and I'm transitioning to full-time at iCAN this summer. But thank you so much for sharing everything. And as Mitch said so profoundly, is that every single one of you on this call has the ability to make change in pediatrics. And just like he said, we are so grateful to have you on this call because of the fact that, you're already showing that you want to make change. So thank you to all of you. And thank you, Mitch. So I'm going to go ahead and pass it over to Abby to ask the next question.
Perfect. Thank you so much. So as you just shared, your career has taken you through so many different kind of avenues, which is so exciting to hear a little bit about. Some of those include pediatric clinic and a global research organization. How have all these experiences shaped how you see patient engagement in clinical research?
Yeah, thanks, Abby. Good question. So seeing it from different lenses. And so we all have bias. We all have preconceived notions. Experience is wonderful, but there's a good saying that experience can be the enemy of learning. So if you have a wealth of experience, but you're not open to learning and listening, it's not good. So the idea of what I've been exposed to over the years, seeing it from different lenses, having really intimate conversations with parents and families and patients of all ages. On the flip side, dealing with other pharma companies and dealing with budgets and dealing with timelines. The clinical research world is challenging. It may cost a company millions and millions of dollars to conduct research, and if it doesn't pan out, there's no money from that. So research is challenging. You do have budget limitations, but for me, seeing the different lenses, getting empathy for those with whom I'm working, both patients and professionals. The idea of patient engagement, it's really only been the past 10 years. Nobody really used that term patient engagement 10 or so years ago. There are a lot of terms now: patient centricity, the patient voice. The FDA has done a good job, as have EMA and the whole industry, of understanding the importance of the patient voice. So that patient engagement, that term has grown a lot. Now there's a lot of infrastructure, whether at UCB or other pharma. It's proven now and expected that pharma companies and CROs need to incorporate the patient voice. So that patient engagement really is important from the beginning to the very end. So anyway, sorry, I mean that whole, all those different perspectives have helped me where I am today. I'm very, very lucky to be on a team that's diverse. We have different thoughts and opinions. We take pride in the work that we do. We are empowered at UCB as well. And, I think our team members across the globe feel that empowerment. So it's definitely something to say it, but it's something else to do it. So anyway, again, sorry for a long-winded answer, but I hope that's helpful as to where I am now.
Thank you, Mitch. And like he emphasized, patient engagement is like a new phenomenon. So within the past decade, so you are part of this new and upcoming change in the industry. And so with that, Mitch, you've collaborated with iCAN, Transcelerate, and Innovative Medicines Initiative. So how do you approach such collaboration and teamwork, especially with the diversity from all of these organizations? And how do you see patient advocacy shaping the future of clinical research?
Good question. Thank you. So I'll go back to COVID. Remember when COVID first happened? It was March of 2020. In that same year, we were working with iCAN. And if many of you remember, there were very few opportunities to go out and do things. But we actually had a focus group with iCAN during COVID. And we were able to have interactions with kids and youth from across the world. We had a really nice focus group. The insights we gained were huge. They impacted across our pediatric portfolio. So, that's one example of being agile and being flexible. So I would say from a personal standpoint that the fact that we had already began building that relationship with iCAN, that we were able during COVID, when many people were not able to interact, we were having settings like this. We could get the virtual focus group happening to get the insights we needed. At an interaction level, I would say, speaking up, listening to others. I already mentioned the experience piece is important, but listening. People have laughed at me. It was only a few years ago that I realized that silent and listen have the same letters. So let me say that again. So listen and silent have the exact same letters. I don't know how that happened, but it's impactful because so many people don't listen, whether it's our day-to-day life, whether it's with our parents, our family members, siblings, coworkers. Oftentimes listening is a thing that's not done enough. There's a difference between hearing and listening. You can hear sound, you can hear things, but are you truly listening to someone? So that's where, again, interacting with patients and getting their input is key, because you need to take the time and be silent and listen to what they have to say. That said, on the professional standpoint, that you need to speak up. There are many settings, whether with IMI or Transcelerate, that my opinion is valuable and equally important to anyone else in the room. So my suggestion to all of you is, if you're in a situation, maybe it's a classroom or a work setting or a situation like this, maybe there are 10 people in the room and 9 of which are saying something you disagree with, that's okay. Be that one voice to speak up. Likewise, if you're in a situation where there are 10 people in a room and you're one of those 9, you think this is the best approach, best decision, but there's one person offering a different voice, listen to them. So that's where collaboration comes in. That's where not being afraid to share your opinion, not being afraid to listen to others, being able to pivot, being able to change one's mind is important. That ability that comes out, I think, in leadership and emotional intelligence. If you're not familiar with emotional intelligence, it's called EQ, and it's basically over the past 5, 6, 7 years has grown more in popularity because it's important to have that emotional intelligence. It's basically empathy and thinking about what others are going through, being able to read scenarios, read body language, read comments, read what's being in part of a conversation, and that can help the communication stop. In terms of patient advocacy, gosh, I think again, my world, I've been involved with patient advocacy since my first job, and it's grown over the years. I think the internet certainly has helped that. There are situations now where many chronic conditions have online support. They have the ability to impact patients very quickly. And every time I say patients, it could be parents, caregivers. There are so many. There's not one single walk of life who's not affected in some way by healthcare. So the idea of clinical research, whether it's patients, caregivers, parents, etc., anyone in that circle can be impactful and contribute. Again, it kind of gets to that lens piece that I talked about earlier. So in terms of clinical research, patient advocacy is hugely important. Again, I'll use iCAN as an example. iCAN, what are you up to, 90 chapters, I think, globally? So I was just telling someone the other day what iCAN does. So it's a good example of this focus for iCAN is on youth, and that there's a gap there. And that's why I'm so glad that other companies utilize iCAN. There are many ways that iCAN can impact the world, and that's because of members such as yourself. So it's not about the age, not about where you are. It's about your personal experience, your personal situation, your ability to share and speak your voice. So I would say, think of your voice as important, and you want to share that anytime you can.
Thank you so much, much, Mitch, for answering that question, and also emphasizing the need for looking at the child in a whole child approach and understanding that, you know, they exist just beyond themselves and looking at the caregiver, especially when it comes to clinical trials. So thank you so much for that insight. Then I'm going to go ahead and pass it over to Abby.
Great. So our next question is, in your 8 years at UCB, how have you seen patient engagement and study recruitment change? Are there any interesting trends that are catching your eye?
Yeah, wow, another good question. So good stuff. So let me rewind it. So everybody's seen a taxi, everybody's seen a bus, everybody's been to a movie theater, everybody's probably been to an airport. All of those places I've done ads for clinical studies. About 20 years ago, we had this entire set of taxi cabs in Austin, Texas, that had this ad, and it was really cool. We were able to have that taxi ad run for a few months, basically like, I don't know, 50 taxis throughout Austin, Texas were utilizing this ad to generate awareness for their clinical study. In Florida, we had bus wraps. If you've ever seen, cars with designs and visuals, we had these big bus wraps. That it was not as common then; it's more common now. But again, we had ads running. Movie theaters, we've had movie theater ads run. When you go see the movie theater, you have those 30-second promos at the beginning. We've done that. TV, radio, print. So some of you probably watch TV. You may or may not listen to radio. You probably listen to Spotify, etc. Print. Do you even know what that is? I mean, print, newspaper, magazine. So all those we used to do. We call that now traditional advertising. But all those things we utilize to generate awareness of studies. So if you can imagine, we would plan ads for TVs, and we would get input from patients to say, what channels do you listen to? We do focus groups, and they'd say, okay, if you're in rural area, I watch this TV channel. Then we'd work with our marketers and focus on that TV channel. Print, if we realize, newspapers at the time or magazines, we would put ads in there to focus on that particular audience. The reason I mention all that is hardly any of that's done anymore. We're in a totally new age. So if I were to do those things now, the cost would really likely outweigh the benefit, the interaction. So technology has evolved to a point where all of you in your lifespan, you know the internet, that's your life. And so that's digital, the digital world. Technology has changed how we do things. If I were to say, hey, I want to go now reach patients through TV, people might think I'm crazy. But if I say, hey, I want to reach patients through digital, through social media channels, let's have a focus group. Let's say our target audience is teenagers. Do I think teenagers are using the same social channels that I am as a 53-year-old? Probably not. So I need to hear the voice of that youth. Likewise, let's say I'm doing a study in Parkinson's or Alzheimer's, and my target group might be the parents and or adult siblings in their 30s, 40s, 50s, and plus. So maybe I want to interact. So that, again, I need to hear input from them to find out where they are. So the idea of the evolution has been affected by technology. One thing I think now in terms of looking forward, it's AI, artificial intelligence. That's huge. While I'm thinking about that, if anybody wants to put in the chat ways you use AI and or ways you think AI will be used in the future, please do. That's a big trend that is here, and it's here to stay, and it's coming. And I think we've only scratched the surface in terms of how that's going to affect the health industry, but clinical research as a whole. The technology piece, now I'm pretty sure most people have smartphones. Most people use some form of social media. Data is out there every time we go and get a prescription, every time we go and buy something. When I go to my doctor, there's data. And so the empowered patient has evolved over the years. Patients have a right to their data, and they have a right to know where their data is going. So, the idea of if you're in the healthcare system, that data, there are ways to see that and find that are anonymous, but we can kind of have an idea of where certain locations have more of this particular condition or that condition. So that can help dictate, which countries we want to go into. It can help dictate where our study sites might be. You've probably heard of decentralized trials, or DCT. or virtual model. That was happening before COVID, but when COVID came up, it spurred it on even more. So now DCT or decentralized clinical trials are part of the norm. And I work now at Transcelerate. We're investigating that even more to see how that's evolved. So anyway, sorry, Abby, but the idea is that technology has been a huge driver. The idea of the patient being empowered and not having to like be at the mercy of their own doctor. Patients are out there now, and they can dictate where their data goes. They can dictate that if they can find studies that they want to join a study. There was a great story. It's great. It was a story where a patient fired their doctor because they weren't getting what they needed. So doctors are wonderful, but doctors are human. And just as you can have a good patient engagement person or a bad patient engagement person, you can have a good teacher or a bad teacher. The same can be said for any profession. So the idea of that empowered patient is huge. And so that, I think, has helped in the sense of if we can make sure to make studies accessible and make sure that we're doing what we can to make people aware of studies, that'll increase the likelihood of people having access to clinical studies.
Thank you so much, Mitch, for demonstrating exactly how things are showcased and touching on the fact that social media is now used, and that's what a lot of our youth actually use as well. So we're happy to see that you're leveraging that. And then going on to the next question, juggling professional responsibilities with community work like coaching and mentoring, how does that mesh with your role at UCB?
Yeah, it's great. I'm very, very lucky. My wife jokes that she wished I worked at UCB for all of my 25 and 28 years. So I absolutely love what I do. I'm very lucky to work with a strong group of colleagues that are global. Every day I speak to people from around the world, whether it's Japan, Germany, different countries in the EU, certainly all across the US. That's diversity. That's diversity of thought. So that allows me to learn from others and also to have impact on others. Our team is empowered. I'll speak kudos about UCB that from top to bottom, middle out, up, down, whatever, that empowerment, that accountability is really ingrained. UCB is a wonderful company because we have a vested interest. We take pride in what we do. So I'm able to interact with patients. I'm able to interact with study teams. Able to apply influence, to contribute to strategic planning, to give input on budgets, to make sure we incorporate the patient voice. I've had situations where I'm presenting to 500 people, to where I'm having intimate sessions with 4 or 5 patients. The race, we have an annual race. I mentioned this earlier to Abby and Sabina, that part of my role, I'm able to MC a race each year at our site. And each year we pick about 3 different patient groups that we'll work with and help raise money, but also awareness for them. And we do it around Halloween. So we're able to wear costumes, and I've been Darth Vader, I've been a cowboy. So it's fun, but you're dealing with situations where the idea of patience, it's not, whether it's chronic or acute conditions, patients live with conditions every day. And so it's not just one person, it's the family. It's, again, the parent, it's the sibling. Autism. My wife's brother lives with autism. So when I met her, autism has been a part of my life for 26 plus years. So I'm well aware of the need for empowerment, the need for pharma to listen, the need for clinical research entities to listen, to incorporate the patient voice. Certainly chronic conditions, it's something that impacts both individuals, but also their family and community. So I feel lucky that the situation I'm in, I'm able to not just do one thing. You can do different things. So my recommendation to all of you all is that, find what you enjoy doing and then expand your horizons, but never feel like you're limited. I don't care what your job description says. Feel like you can bring something to the table. I don't care if it's your first job and you're a teenager. Bring what you have to the table. My daughter's 17. She's had a couple of jobs, and she's developed that leadership skill already. It's not about age. It's about bringing, again, what you have to the table. So I've been lucky that my personal and professional life, like I said earlier, has evolved and helped me where I am today. So I hope anyone can have that same type of experience. Think about people that you, whether it's a teacher or a parent, think about people that you've learned from, but then also think about people that you can impact, people that you can quote mentor, that you can help. That's where, again, that idea of empowerment really should be felt, hopefully, in all of us, and that we can impact the world in both our personal and professional roles. So I've done, again, the coaching. Like I said earlier, I actually do. I'm a coach now. That's a little bit different. It's coaching colleagues and professionals where they're the experts, and I just prompt them with questions. And that's not really mentoring per se, but it's where I'm just helping them navigate and kind of pulling the ideas and success from them. So that's something that's a bit different, that is not part of my day-to-day job description.
Again, Mitch, thank you so much for answering that question. And just like you said, you should always find what you enjoy, be a leader, and never feel limited ever. And with that, and thank you again also for sharing that personal connection to your job. And again, everyone, when you are searching for what you want to do, make sure that, for me too, I always want to feel personally connected to what I do. And I think that's where you derive a lot of your passion from. And I can tell, Mitch, you're very passionate about what you do. So definitely take that with you as you search for what you want to do in the trajectory of your life. And then I'm going to go ahead and hand it off to Abby.
Perfect. Thank you. So this is the last question of kind of the interview style portion. And after that, we'll be able to get to everyone's questions they've been putting in the chat. Thank you so much. So continue to keep them incoming. But Mitch, as a parent of 3, how does your personal experience influence how you approach patient engagement, especially when it comes to kids involved in clinical studies?
So one, I think we're all holistic. Like I said earlier, we bring our personal lives to work and vice versa in a good way. There have been several times where I would be interacting with patients and tears would come to my eyes because I just could feel what they were going through. And you can't help but be a parent of and a son. Again, it's important that I mention my parents were teachers because I grew up in that environment. So the environment with which we grow up can dictate and help navigate us in that particular direction. So I've been hugely lucky my entire life, but now every day, I do think of my wife and kids when I'm doing work, and I encourage my team to do the same. We don't call it work-life balance, we call it life-work balance. Life is more important than work. So that said, the decisions that we make, we want to not use our own voice, but capture and utilize our experiences and our voice, but also realize, again, we have our own biases. We have our own preconceived notions. So, I take pride in shutting up and listening. So again, the idea of silent and listen, it's really cool that they have the same letters because it emphasizes you gotta just listen and not talk so much. But my experiences have I can't say enough that my professional world and professional evolution, it continues. And so I learn something new every day. And that's not just saying something, but every interaction I've had with patients has helped me both personally and professionally. We have something we at work call We Are Patients Too. We started that, 6 years ago, where some people I think view pharma as this outer worldly thing or something else, and it's not. Pharma companies are made up of individuals that are dealing with chronic situations and different lifestyle situations as well. So anyway, we started that We Are Patients Too, and it was very the amount of empathy we could get with our coworkers was good. Again, thinking about autism, if you had asked me 27 years ago about autism, I wouldn't have known that much. But now, after living and breathing it and seeing our family, in particular my mother-in-law, who I'm so lucky to have. I mean, autism is a thing that affects the entire family. So now I'm able to apply those learnings and that empathy and that understanding to the work I do, every day. So I guess the message is that all personal and professional experiences help shape who you are, and they help kind of make your thoughts and opinions in terms of every professional interaction can help you dictate that. So, that said, I think that the clinical study piece, again, there's a lot that's happened in the clinical study world for many years, but even now, many people are not aware of clinical studies. The single reason most people don't join a clinical study is they just don't know one exists. So that's on us. That's on the industry. That's on the professionals. That's on the healthcare providers. There's no reason that anyone who is living with a condition and wants to be part of a clinical study, they should be able to be part of that. And again, going back to the empowered patient, the idea of understanding the importance of the patient voice, and that if you think about the entire clinical development continuum, every drug, every vaccine, every pill, every liquid, anything that's a medical treatment, that's gone through clinical research. And that could take 10, 15 years for that type of thing to happen. So the importance of clinical research really can't be understated. So I hope that answered your question, Abby.
Thank you, Mitch. So moving on to our fireside chat to questions from our audience and our youth members. We're going to start with Anya. And Anya asks, what challenges did you face during your time at school or in your career? And then she also wants to know if you have internships for her at UCB.
We do. So I'll answer the second question first. Yes, and both with high schoolers, but also in college. So UCB, it's again global company. We're headquartered in Belgium, but we have companies all across the world. Interning is something that's commonly done. I can speak more about the Raleigh office. So again, I'm in Chapel Hill, North Carolina, but our office is in Raleigh. But we've had interns during the summer every year since I've been there. Also, if you think about PhD students or pharmacy students, we've had them as well. So there's definitely an opportunity there. I'm not sure where you are, but we have locations that are on the West Coast and up in East Coast as well. But it does depend a little bit on location. But we've had scenarios where people did virtual internships. So certainly that's something our website, ucb.com. But if anyone wants my contact information, please, Abby, Sabina, feel free to share as needed. Did I answer the other question? Was it challenge?
Yeah, the challenges that you faced during your time at school or in your career.
Well, so it's funny. So I did my undergraduate work at East Carolina, but then I did grad school at North Carolina, and I did that. My wife was pregnant with our second child. And so I went back to school when I still worked full time. So a challenge, and that may not be the nature of your question, sorry, but the challenge there was that here I am working full time, but then going back to school. But my wife, if I didn't have her, I wouldn't have been able to do it. It was challenging for her as well. But fast forward, it was a great experience, and that was early 2000s that I got my graduate degree. But that challenge of life and things happening, I'll never forget. I was doing this kind of puts it all together. So I was in Austin, Texas. We were doing a TV shoot. It was a study. We were doing a worldwide clinical trials. We had 200 plus sites across the globe. It was related to vaccines for flu when you immediately get flu symptoms. And we were doing all these TV ads that we would use across the globe. So I was in Austin, Texas, but I was still in school. So I remember we were at a house, we're on location, we were doing a commercial. So any commercial you see, it's cool, all the behind the scenes and production that goes into that. But we're at this person's house, location, filming, and I was trying to find a good Wi-Fi because it wasn't working in the house. So I walked outside, and I'm literally on the sidewalk with my laptop. I'd finally gotten a signal because I had to turn in something for my assignment. So in that span of an hour, I'm missing my wife and kids, because I was in Austin, Texas for like a week. I'm missing them. I'm trying to get this assignment in. Oh, and by the way, there's this $2 million production happening that I'm overseeing and helping out. So anyway, that's something where, multitasking, taking things one step at a time, not feeling overwhelmed, but doing what you have to do. So I do, like the travel I mentioned earlier, It may sound great that I was in some of these places, and it was fun. I mean, it was, going to Australia, going to Buenos Aires, Argentina, going to Vienna, going to Prague, etc. But while I was doing that, my wife was at home, and my wife's a full-time shop. She's a graphic designer, so she's working too. So again, gets back to that. If what raised me was my experience with my mom and dad, but now throughout these 28 years, my wife's been there, and she's a full-time employee, full-time worker, graphic designer, doing her thing. But it takes more than just one person to do anything. It takes that. There's a saying, it takes a village. So stop and smell the roses, and stop and appreciate what you have. Luck is when preparation meets opportunity. Let me say that again. Luck is when preparation meets opportunity. So sometimes life is horrible. Sometimes life is bad, but also you can make your own luck. If you do work hard, if you do take advantage of the opportunities you have, you can get, quote, lucky. So I would encourage all of you to take advantage of your opportunities, to work with teachers, work with your parents, work with mentors, become a mentor yourself. Who's someone you can help? Is there a younger person in your classroom or friends? Is there someone in your community? Anybody that you can impact, you can do that now. So.
Thank you, Mitch. Thank you. And I have to emphasize, you're such an amazing speaker. Everything that you say, I'm just very reeled in. Thank you. And then Mary Rose asked, how do you think questions or opinions can be encouraged to be shared in meetings and classrooms for people who aren't as comfortable with it?
Oh, that's great. There's a word called invite. I invite someone to do something. So I would say, if you have a thought or opinion, maybe it's face-to-face in a classroom, and maybe it's you're disagreeing with someone, you can say something like, I invite you to think about this. And that's a nice sort of way to say, hey, I'm inviting you, but let's think about a different thought. Or one of the most empowering things to say is, I disagree. And you can say it in a nice, calm, polite way, but say, I disagree, and here's why. And so, one negative thing in today's world is there's a lot, whether different TV channels or news channels, there's a lot of negativity out there, of course, but the idea of healthy debate, important face-to-face interaction. So I would say, feel comfortable in that if your best interest is for the people in that setting, whether it's a classroom or a focus group or whatever, have that same tone of that it's okay to disagree. So it's very empowering if I politely say, I disagree with you, but here's why. But then I need to be able to be agile and change my own mind. Now, if I go into the situation and say, I disagree with you, if I'm totally resistant to other people, if I'm not listening, then I need to address my own issues and improve myself. So again, the idea of a lot of these things you learn in grade school, in elementary school. So, saying please, thank you, and you're welcome, that requires no talent. There's zero talent to tell someone, can you please do this? Or thank you for that. You're welcome. If you open the door for someone, they say thank you, say you're welcome. Those little things carry a lot of weight when you get into the professional world. So I would say, again, feel comfortable that any setting you're in, to feel free to bring up a question. And again, the idea is to have good intentions, obviously, but be polite, professional, but also be, you can be firm. And we call it being humbly confident or being confidently humble. So humility is great, but you also want to feel that confidence that you can share and give your opinion. And anyway, it's a great thing when that kind of environment, if you foster that environment, others reciprocate, and then that's where you get really good results. If you think about a recipe where you have all the good ingredients, that's where you get that best recipe. So again, good to have those types of interactions and expectations for that.
And I completely agree with that sentiment, Mitch. In my own classroom, I teach, I respectfully disagree and explain why, and I respectfully agree and explain why. I love that. So using your foundation as, a way to navigate life, especially in the future within your career as well. Now we have a question regarding the digital platforms. So it's multifaceted. So how do you figure out which age groups use which digital platforms most? And then how do you engage with people who don't use social media at all or are just not present on the internet?
Yeah, great questions. We really deal with that on a daily basis. We have a person on our team that their title is Clinical Study Digital Outreach Manager, and she's based in UK. But her role is really to conduct social listening, to find the different channels. I say channels, the different social media channels that are out there. Where it could be in Japan, maybe there's this social channel, whereas in EU there are these channels. Are they predominantly English or other languages? So there are ways you can find that out, and that it's all publicly available information. If I use Facebook for an example, Facebook 10 years ago would have had a lot of probably younger people doing it, whereas now there are fewer younger people doing Facebook. So Facebook is a good avenue to reach people in their probably 30, 40, 50s, et cetera. But there are other channels that just aren't used. So there are ways that you can find that type of information out to see the landscape, and we utilize that all the time. Your point is well taken about not everybody uses social media, and even those that do, there are other channels. We call them communication channels to reach people. So that's where if we are in a region, we hopefully have contacts, patient groups that we can interact with. I don't mean to speak for all of UCB, but there are ways that you can have community interactions and to have face-to-face interactions that you can get that direct input. Things like focus groups, interviews, surveys, those are all types of patient engagement. So there are ways that people can, be found and then have participation that doesn't require, say, a social media presence. The digital space is certainly huge. Obviously now the world we live in is different than where it was even 5-10 years ago. So who knows where it's going to be from now. But basically the idea is to take advantage of the regions that you're in, tailoring to the particular regions and cultures, tailoring obviously to the particular languages. If we have a global study with 15 different countries, we know that the input from those different countries is key. So if we're able to do some type of interaction and get patient input, ideally we get input from that whole diverse population. So it's definitely time consuming, but it's certainly well worth it.
Thank you, Mitch. And this is from Uma. She wrote, "Hi, I'm super interested in your work. I am in pediatric clinical research now, and she is going to medical school." I added that. And
Good.
a research group is hosting focus groups for the next 2 weeks. What suggestions or recommendations do you have to increase patient engagement and empower participants during the focus groups? Also, do you think there is anything more that physicians and other healthcare providers should do to increase patient engagement and accessibility in clinical trials?
Yeah, wow. We could and should spend another couple hours just on those two topics. So one was access, which is an important element now. Just in my small world, we're actually talking about that within Transcelerate, the access piece. So that certainly is a huge important element. If I go back to East Carolina University, that's in Eastern North Carolina. It's more rural areas. The population is less. The education levels are less. The access is less. So if we just use the U.S. as an example, are you in a heavily populated area or a more rural area? Unfortunately, that can sometimes dictate your ability to access things, even like Wi-Fi. Things many of us take for granted, access to Wi-Fi, food and shelter. I mean, there are many situations where we could spend hours on that, but the idea of everyone's day-to-day challenges, just access to healthcare, place to live, those in and of itself create challenges. To your question about the patient engagement and the focus group, one thing we always encourage is that to manage expectations early on with that focus group, those members. So if you have, 10, 12 people within a focus group, to make sure they understand in advance that their opinion is important. They really should feel empowered to share their opinion. If they don't feel comfortable sharing something in a face-to-face setting, even writing things down, if you're having a face-to-face interaction, you're going to have different personalities. And some people may consume a lot of that oxygen and they may talk a lot, whereas you have 4 or 5, 6 other people who aren't as talkative. You're all familiar with extroverts and introverts. So sometimes the person speaking the most it might drown out some of the other people who aren't able to speak. So that's where having a good facilitator, she or he, that person being able to facilitate the discussion and making sure that if you have that focus group, is it an hour, 2 hours? Is it a full day? Is it virtual? Is it hybrid? Is it face to face? Having that perspective so that each person understands their importance. So a good facilitator can really help facilitate that. But I would add that after the fact, if sometimes after focus groups, people have thoughts that come up, and it's almost like they've had a mental debrief and they think of things they should have said. So sometimes follow up after the fact is good. We've had scenarios where people could opt in to have a one-on-one interview after the fact, or people could opt in to be contacted and they should have a phone call to touch base. So just to have that option, that idea of flexibility, so that people sometimes prefer communication in different ways. There's again, with personality, some people may prefer to share something more in private and maybe in writing or one-on-one versus a setting with a lot of people.
Thank you, Mitch. And thank you for sharing that. Focus groups are very nuanced and we have to account for all of that. And then Chloe, you kind of already touched on this before, with the opportunities for internships, but she's actually trying to start a club at her high school for those who are interested in the medical field. And she's located in New York, but would you or your company be able to offer us any opportunities? So she's specifically looking to invite like guest speakers or, have some hands-on learning activities, anything that, you could recommend that she could look into. And she's super appreciative.
Yeah, yes, and yes. Please feel free. You guys can release my contact information, but we've done that. One example is Pepperdine University. So I'm based in Raleigh, North Carolina, East Coast, but I interacted with the Pepperdine University students. It was 2 years ago, but I had multiple meetings with them and talked to their students and just was kind of there to give feedback and whatnot, and it was great. So we definitely, whether it's a local situation or any place, we can make time. So definitely there are many other quote experts. So again, this ask the expert session, you could put 100 other people in this setting. So it's not just about me or one type of people. There are a lot of people. So, but yeah, we definitely take advantage of that. We would want to assist you in any way we can. So please feel free, Sabina, Abby, share my contact information. It's something we take pride in, our community involvement. If I can speak highly of UCB, we have time for volunteer hours. They encourage you to volunteer in your community. The idea of our effect on the world, sustainability, the environment, that we have an impact. UCB is doing it right. They emphasize to their employees to get out there and make a difference in your world. So that's a long-winded answer. So yes, I'd be encouraged to. I can have other team members as well. We can definitely help out and give a perspective.
Perfect. And I will put you into contact with Chloe. Thank you, Chloe, and thank you, Mitch. And so if there are any more questions, go ahead and put them in the chat. And she says, thank you so much. Chloe and Uma also says, thank you. So with that said, you gave us a ton of advice for every single question we asked you. We loved it. Again, you're an amazing speaker.
Thank you.
And with all the advice that you gave us, what is one takeaway that you would like us to leave with today from this Ask the Expert session?
So a couple of things. One, I appreciate you saying I'm an amazing speaker. It wasn't like that, so everyone on this call, every teenager, youth, I think, speaking in front of people is a challenge. I think it's like the top three of, like snakes or something, or heights and stuff. And so, challenge yourself to get out there and get out of your comfort zone. Whether it's talking to 2 or 3 or 4 people, or presenting in your class, or going to a conference, or the fact that you're affiliated with iCAN is huge. So, speak up, become that voice. Few other random things. One, be a sponge, absorb information, absorb input, intelligence, whether it's from a mom or dad or a teacher. It could be someone on the bus, someone in the subway. There are a lot of interactions that happen every single day that you can pick up on both what's good and what's bad, how not to treat people, how I challenge all of you today, go out and say, please, thank you, and you're welcome to a stranger. See how that smile comes on their face. Open a door for somebody. There are a lot of ways to impact the world. Second thing, make mistakes. Go out there and make some mistakes. You learn from them. There are obviously different levels of mistakes. I don't mean go and rob a bank, but I mean make mistakes of trying new things and doing different things. So you learn from those mistakes. If you make mistakes, then make some more. So you get to where you are by building that foundation. And if someone is not willing to make a mistake, not willing to try something new, to maybe say something or try something, you're not going to get out of that potential to do more. So again, think about kind of what your impact can be, and don't be afraid to make a mistake. If you make something, if it's something where you've impacted somebody else, maybe a friend, you did something that you feel is bad, or a parent or something, apologize, move on. In the work world, though, mistakes are what help us move on. I mentioned emotional intelligence. Obviously schooling is one thing, and getting access to education is important, but that day-to-day interaction we have with people is hugely important. So that ability to empathize with someone, that ability to potentially think about what someone else is going through, that can help you in your interaction with them. Use your voice. So again, you are the expert in your world. So if any of you are interacting with your doctor, if you're interacting with your parent, be an advocate for yourself. And it doesn't mean be a jerk. It doesn't mean not listen to people, but feel that your voice is important, and you are an empowered individual. So feel free to utilize that. I think that's it. I hope this has been helpful. It's certainly been wonderful for me. So I thank you all for the time.
Thank you so much, Mitch. And we appreciate all your time. I wrote so many good quotes from you. We absolutely loved your presence. And I'm sure all of our youth members are very appreciative, as they did write in the chat. And we can't wait to get in touch with you regarding the October event. And for our youth members, don't forget to register for the summit. It's by June 1st, and we're really looking forward to seeing you at this year's summit. We appreciate it. And there's also it's not March, but it's actually supposed to be in June. It's a little error. It's okay. But it's registered for June's Ask the Experts with special guest Dr. Chloe Chavon and Olivier Werner, and definitely do that. And then again, our summit is coming up July 15th to 19th. Registration is due by June 1st. We're looking forward to seeing you there. And again, thank you so much, Mitch. We're so appreciative. You literally captured the entire audience. I loved it. Absolutely. And thank you for the insight and patient engagement.
Well, thank you, Sabina. Thank you, Abby. Thanks, everybody.
Thank you. Thank you. I hope everyone has an amazing Saturday, and we will definitely put you in touch with Mitch for those opportunities that he was talking about. Thank you, everyone. Thank you. Have a good Saturday.
Thank you, guys.
Bye. Thank you.